Tubulointerstitial nephritis, characterized by acute renal interstitial inflammation, is a serious medical condition often caused by various factors. This video delves into the complexities of tubulointerstitial nephritis, exploring its different forms, associated triggers, histological features, symptoms, and long-term consequences. 1. Types and causes of tubulointerstitial nephritis. Tubulointerstitial nephritis encompasses different forms, with acute interstitial nephritis, AIN, being a prominent example. AIN can be induced by medications like furosemide and penicillin. The inflammation in AIN is mediated by both type 1 hypersensitivity reactions, involving mast cells, and type 4 hypersensitivity reactions, involving Th1 helper T cells. 2. Clinical presentation and diagnostic features. AIN manifests with various clinical symptoms, including fever, rash, and oliguria, usually emerging 1 to 2 weeks after exposure to the triggering agent. Diagnostic indicators include interstitial edema, inflammatory infiltrate, eosinophilia, eosinophiluria, and the presence of white blood cell casts. Furthermore, elevated serum blood urea nitrogen, BUN, and creatinine are common, indicative of intrinsic acute kidney injury, AKI. 3. Chronic tubulointerstitial nephritis and its causes. Chronic tubulointerstitial nephritis, often associated with long-term NSAID use, poses a significant risk to individuals with chronic pain conditions like back pain and migraines. NSAIDs accumulate at the renal papillae, causing free radical damage and inflammation in the renal interstitium. Over time, chronic inflammation leads to interstitial fibrosis and calcification in the renal papillae. Analgesic nephropathy, as a result of chronic NSAID use, can cause microvascular damage and vasoconstriction of afferent renal vessels, leading to ischemia and renal papillary necrosis. This chronic condition ultimately culminates in chronic kidney disease and bilaterally small, scarred kidneys. Apart from NSAIDs, chronic tubulointerstitial nephritis can also be caused by chronic lead exposure and prolonged lithium use. Additionally, autoimmune diseases such as Sjogren's syndrome and lupus contribute to the development of chronic tubulointerstitial nephritis. Conclusion, implications and importance of early recognition. Tubulointerstitial nephritis, encompassing both acute and chronic forms, poses significant challenges in the field of nephrology. Recognizing the various triggers and understanding the pathological mechanisms are crucial in early diagnosis and intervention. Healthcare professionals must be vigilant, especially when dealing with patients on potentially nephrotoxic medications or those with autoimmune disorders, to prevent the progression of tubulointerstitial nephritis to chronic kidney disease. Timely identification, appropriate management, and patient education are paramount in mitigating the impact of this condition on renal health and overall well-being.